So I want to actually invite the next group up here. One of the things I thought was really interesting was the concept of people wanting to how do we get the right information back from the consumer? And what I thought was great about this when AARP, Jeff McCalca and Sanjay spoke to me, I thought it was really interesting, the group of partners that they brought together for this, for Project Catalyst. And so this session kind of is going to hopefully, I haven't heard them talk yet, but highlight this relationship and what they hope to get from it, and hopefully we'll see some good feedback.
Okay, great. Thanks, Jill. Good afternoon, everyone. My name is Jeff McCalca. I work with AARP, and my colleague Sanjay Karan and I will be moderating this excellent panel on a project that we think is unique in the marketplace and help the whole marketplace focus better on not only the needs and wants of people over 50, which is in alignment with AARP's mission, but also improve the overall products and services that are brought to market in the digital health arena. I think I have a couple slides. A lot of people, when we give talks, we wonder, what's AARP doing at a digital health innovation sort of summit? And for us, it's pretty clear. And I have my slides. All right, well, I don't need them anyway. For us, it's pretty clear because it's direct line with our social mission, which is to improve the quality of life for all as we age. And as many of you know, there are over 100 million people that are over 50 right now. And the highest growing sector of the population is people over 85. And these people tend to consume a lot of the healthcare resources in our country and around the world. So it's our mission to improve the quality of care and improve the quality of life for all of these people through interacting with entrepreneurs and innovators, and to build better products and services that meet not only the needs of our population, but in general. We have a program called Health Innovation at 50 Plus, and in it we have about 4 different areas that we look at in trying to stimulate the marketplace and the ecosystems to build better products and services for people as they age. So our first initial outreach has been to build industry outreach and create different connections and relationships within the digital health ecosystem so that people are aware of the needs and wants of people over 50 and think about the market opportunities associated with that. So then we moved into stimulating market development, which is really to illustrate where are the areas that need to be met, and where are the highest needs, and where are the highest areas for revenue and income possibilities related to meeting the needs and wants of people over 50. We project that there's a $100 billion opportunity related to meeting the needs and wants of people over 50 in out-of-pocket consumer spend over the next 5 years. 30 billion of that we believe is directly related to health and wellness innovation in the digital health arena. Once we find companies that are interesting and intriguing to people that are over 50, we tend to try to showcase them not only to the industry itself, but also to venture capitalists and other investors, as well as our AARP membership. Last month we had an event down in Miami, Florida, where we did something what we call the AARP Live Pitch Program, which is our version of Shark Tank, where we brought 10 innovative health and wellness companies. We put them on stage, not only in front of a panel of investors, but also in front of AARP members. And we give each of the AARP members that attend our event an audience response device, and they vote in real time to the pitches of the entrepreneurs. And 2 of our winners, one of our consumer awards winner, Audicus, and one of our investor winner, Split Second, are actually displaying here out in the foyer. You should ask them about their experiences on the stage. And the last part of our program is really involving the member in the innovation ecosystem and innovation lifecycle. So we're going to talk a little bit about our main program in this, which is called Project Catalyst. And I'm going to let my colleague Sanjay talk about that right after we get to our esteemed panelists. So, Nick, would you like to say a little bit about yourself? He's swapping in for Pete from MedStar. He couldn't make it with us, but would you talk a little bit about MedStar, what you do, and a little bit for the other presenter as well?
Sure. MedStar is a large healthcare delivery system in the Mid-Atlantic region. You've probably never heard of it, but we're a dominant player in that region, and probably have heard of Georgetown University Hospital. That's one of the hospitals we own and operate altogether, about a dozen hospitals in that area, and mostly in Baltimore, Washington, D.C., and Florida. And it is a kind of a microcosm of the entire U.S. healthcare system, because we range from inner city to rural, from very wealthy health care type of provision to the most poorest areas in all demographics. So in a way, from outpatient clinics to referral center hospitals. So it's kind of a microcosm of the whole healthcare system. and allows us to do a lot of different things and test them for the U.S. healthcare system. Within MedStar, we have an organization called MedStar and Innovation, or MI2, which is a little bit different from most innovation centers at healthcare systems, whereas most of them are focused on bringing innovation to their healthcare system. Ours is really innovation that enhances health anyway. So we are not an inwardly focused innovation institute. We are ultimately working with all kinds of entrepreneurs on anything that enhances health. We develop a lot of stuff ourselves, whether it's in informatics, digital health, or even orthopedic hardware, all the different areas, and we do a lot of work in human factors. So we're very delighted to be here. My own background is that I'm formerly the Director of Strategic Initiatives for MI2, and now I'm a fellow with the Institute, but have had a long history of working in senior care and own and operate a number of long-term care facilities myself.
We're going to have a conversation because I think your title's actually better than mine, a fellow at the MI2 Institute. It's pretty cool.
It sounds very secretive.
Yeah, you have a gun somewhere on you right now, right?
Well, not only are they MI2, but the address is 007.
007, yes.
007. Too much spy and spook, DC influence.
Yeah.
Julio?
Sure. Good afternoon, everyone. So I guess we're your lunch entertainment. I forgot my guitar at home, so sorry. It's just going to be talking. But I work for Pfizer, one of the top biopharmaceutical companies in the world. Our goal is to identify therapies that can help improve patients' lives significantly. And I work within a group which is called Worldwide Innovation, which is meant to inspire people within Pfizer and encourage people to innovate. And obviously we have a long history of that because we have a large brand around research and development and developing new compounds. But our team is more broadly talking about innovation from all the groups that can change the way that they work on a day-to-day basis, from marketing to manufacturing to clinical trials, and how they can improve their approaches through innovation techniques. So we build the culture of innovation within Pfizer. We help drive that culture. We have a very large program called Dare to Try that essentially encourages people to innovate and bring their ideas forward and experiment. But we also have a very significant component around external engagement. And that's why one of the reasons why we've engaged with AARP, because it's really important for us to identify solutions that can help move healthcare forward, but also it's really important for us to partner with the people that can really make that happen and help us understand better the customers.
Excellent. And Jennifer.
Hi.
Sandra, you don't get to talk.
I'll give you your turn, don't
No,
worry.
take your time.
I'm Jennifer Dracquelis, and I work for UnitedHealthcare's Medicare and Retirement business. And I wear a couple of different hats at United. My primary responsibility is to work very closely with AARP, who's one of our largest clients, looking at how we can bring innovative new products and services to people age 50 plus. So I have a team of people that are my counterparts in innovation at AARP Services, Inc. And again, work very closely with them on a pipeline of different activities. Right now, we're very focused on looking at opportunities around prediabetes and how do we really help to reduce the trajectory of diabetes that this country is headed toward, starting with some of the important multicultural populations who are at exponentially higher risk for diabetes. So that's been an area of focus for us and a lot of exciting opportunity there. The other thing I do at United is I'm an innovation champion, so I work very closely with our Innovation Council, who is a sub-team of our highest executive leaders at United, who are able to support and fund innovative new ideas that come up from different parts of the organization. So very much, as you heard, I also am responsible for bubbling up ideas from deep within the organization that people from all different levels might have and raising those up, really helping to pitch those to the Innovation Council. And then once those ideas are funded, I help to incubate those ideas. I provide support to the teams so that they can take their concepts on to the next stage. And we have a lot of very exciting things happening in the pipeline there as well. And then the last component of my work is really around looking at future trends. I've spent the last year or so really looking broadly at the future trends that will impact UnitedHealthcare over the next 3 to 5 years. And we've identified some areas of focus for us on that front. So we've organized teams around some of those opportunity pathways, and we're beginning to dig into really trying to create experiments that will help to prove our hypotheses around where some of these trends are leading. So that's a little bit of what I do at United.
Thank you.
Are you standing up or are you sitting?
Okay. Clicker. No, I'm lazy. I'm going to sit.
All right.
So my name is Sanjay Khurana. I work with Jeff, and this Project
have to run
Catalyst
all at
was kind of work, but Project Catalyst has been I guess a fruit of our listening to the market. So I'll step back and how this was formed, and it was not something that we come out with some sticky note innovation session which most corporations go through. So we really were trying to change the narrative in the market. AARP is known for doing advocacy and other things, traditional as you expect from a nonprofit membership organization. Our group was really about engaging with the entrepreneurial community, which is the supply side of the economics and the supply side of the business, is where the innovation is coming from, where the innovation is being funded. So our stakeholders were primarily innovators with early stage innovation around the 50+ areas of relevance. We were also trying to work with the entrepreneurial community. And as Jeff showed you, we had a four-pronged approach towards engaging the market. We did a lot of outreach, educated the market. We do so much mentoring that sometimes it's kind of, it takes a lot of cycles. We were working with early stage companies trying to make them see the opportunity, help them guide their products and services towards a market that is growing. I mean, it's a $7.2 trillion economic spend that this demographic together contributes towards the U.S. economy. That's a lot of money. That's the third largest, GDP in the world after, U.S. and China. So when you look at this, you have to help them see where the money is. And by providing market forecasts, providing some knowledge around the market, we were able to steer them towards the digital health space. But that wasn't sufficient because they learned a little bit. They still were missing, the learnings from the market. Then we started doing innovation showcasing, which if anybody has been...
All this.
I'm sorry?
Get to Catalyst. I already went through
Catalyst, but I got to build up. Hold on. So the thing was, when we did this innovation event, which is a large spring break for seniors event, it is hilarious, it's great, but we put innovative companies for the last 3 years in front of consumers. And what was fascinating is, opposed to contrary belief that these consumers, older demographics, don't care about technology, it is a myth. When we put some interesting companies out there was such a heightened increase in their awareness, because they were looking for these solutions, and they didn't know how to get to it. Secondly, which blew our mind away, was about 66% of consumers who were there, and we get about 10,000 consumers at this event, were very interested in becoming beta users. They wanted to be engaged with the innovators. So that's where we started thinking is, how do we really scale this? Because doing it at a large event and giving them free-form, quantitative kind of a focus group on steroids was great, but that didn't help the market. To move the market, we needed a scalable model where we could put the consumer in front of innovators. And our sweet spot was early stage companies because we felt that we could mold the market from the early stage side because we could really catch the innovation early, shape it through the voice of the consumer. That's when Catalyst was born, and we said, we can do it ourselves, but then again, inherently is the scale problem. So the business model here was born out of listening to the market for 4 years, where the consumers really wanted a pathway to talk to innovators. There was none in the market. Look around. I mean, this is a conference. There's no consumers other than, we eat our own dog food here. So we really needed to bring this new model where we can bring consumers that represent the 50+ with the entrepreneurs. But we needed a business model. So we really created this platform for aging, what we call disrupt aging. That's our hashtag. But it was about bringing traditional and non-traditional players in the market who believed about aging but also wanted to change the narrative. How do we really not build products for this demographic, build products with this demographic? And that was slightly different. And hence we had to catch companies earlier on, okay? We have a thesis around 50+ aging. We've identified 9 areas of health. And I don't expect you to read these, but 9 areas of health really represent all the 32 human needs around health for the 50+. And I'm just going to go back so you see it's pretty all-encompassing. You'll see remote health monitoring, medication adherence, social engagement, physical fitness, diet, nutrition, social engagement. So it set the framework for what we want to test. We brought in traditional players from payer, pharma, medical systems, but we also wanted to look at non-traditional players. So we've started to expand our platform to bring in research organizations such as Georgia Tech Research, that is our sort of what we call Insight Research Partner. We're trying to bring in other philanthropic organizations. We're trying to bring non-traditional players such as telecommunications service providers like Verizon, AT&T. We want the retail channels to be there, the big box retailers, the retail pharmacies, because they're disrupting the healthcare from point of care solutions. So we don't know where this is going, but we knew that we wanted to bring players across the innovation cycle and bring them to help pool their resources together so we can fund research in those 9 areas of health. So this is not a product testing, this is not consumer reports, but we wanted to create a holistic view of if we picked one of these areas, we would go through a rigorous exercise of sort of identifying the area we want to test. And I'll just give you a couple examples. We're just finishing a study with Georgia Tech, an ethnography study with 92 consumers who've used the latest activity and sleep trackers in the market. And we're just coming out with our results. We didn't expect to find something aha out of that. But it was amazing to actually put technology that wasn't developed for them into the field just to know how badly these were designed. And if Jack's here, he's going to kill me.
Yeah, it's lucky Jack didn't have it before the
we put the top devices out there, and the results are going to be interesting. And I'm just going to give you one stat just to kind of suss this out. 90% of consumers who use these 7 trackers, 90% could not find the instruction manual in the packaging. That's how poorly human-centered design has failed for this category. Okay? We hope to change the narrative in the market and help these companies in the next iteration of products to think of including these demographics in design, messaging, capabilities that are missing because companies overlook this demographic when they design the products. Next one is medication adherence, and we look for mindshare from these partners to tell us, look, we believe this issue is important to us. Medication adherence clearly was an area of interest to Pfizer. And everybody, that's a universal issue. Next one could be caregiving, right? We want to find brain health, issues that are thematic. We would find companies that best represent a plethora of solutions. We're not about A/B testing, but we want to put them in the field, get consumers to give real feedback, and guess what? The difference is we share the research back with the market. Our sort of our goal is we want the tide to rise all boats, or raise all boats. And that's what the difference is. Anybody can do research, but nobody shares the research. So this is sort of an open insights research platform with a collaboration of players that themselves have commercial interest. And we don't hold that commercial interest against them, but they're the really ones that are shaping the conversation on the market.
We need United to keep the lights on. So we
yes.
don't want, so.
And that's sort of the whole idea. It's a long game. And as we were talking it's not about finding a product today. We want to build better products for this demographic, and we want companies to be successful because as they're successful, we all can commercialize eventually, and monetize those products to our demographic. So, it's a lofty goal, but we couldn't do it ourselves, and hence we wanted to have players that have a stake in the game. So that's what Project Catalyst is all about.
Got the last slide?
And you can find information about the program and the research that was mentioned, even information about Project Catalyst. And we're excited and look forward to any partnership opportunities with players in the ecosystem.
Great. Thank you, Sanjay. So what we wanted to do after we kind of explained the concept of Project Catalyst was really focus with our partners here to say, how is it that they're involving, not only within Project Catalyst, but within other programs that they might have, large organizations that are interacting with consumers and worrying about trying to incorporate the opinions of consumers and end users in their research and in their product and service development. So, Mick,
Sure.
You guys are a regional system. Of course, you touch a lot of lives, and as you mentioned, you're an interesting microcosm of the whole country, the whole healthcare system, given that you reach into such different demographics, different socioeconomic classes, and different geographies. What else do you do to bring the voice of the consumer into what you guys are doing internally?
Well, we're very interested in the consumer aspect of this, and particularly in the senior part, because we happen to have a very large senior population in our area. And so it's of interest. And going to capitated healthcare, as it's moving in that direction, we absolutely need to know that we have to keep our people healthier. And without consumer engagement in the whole health process, we're not going to be able to keep them healthier the way we used to in the past, just by having them come in for episodic care. So the engagement is very important. And we see the digital part of engagement as enhancing, enabling, and assisting with us being able to achieve that. It's not a replacement for direct contact completely, but it can definitely assist, augment, and enhance. And that's very important to us. And we believe not only improve outcomes and quality of life, but actually in the end help contain some of the costs. So under a capitated model, we have a self-interest in that regard. And I'm sure you do too, to some extent at UnitedHealthcare. So it is highly important for us to go to this. One interesting little tidbit when we talk about engagement and keeping the individuals engaged is a study was done in Great Britain, and they looked at all the different factors of what predicts mortality in people over age 60. And the number one correlation for mortality over 60 was lack of engagement and isolation. So I think that as a predictor of mortality, that's a very telling statement, and we ought to pay attention to that and really work on that aspect of this.
So I'll probably live forever because we spend so much time together. But,
all right. You're right. And social engagement is an overlooked investment thesis by most investors because it's considered as a soft area of health. But what we found is when we do put some of these products out there with members, social engagement seemed to be the most interesting, even though it's got very little to do with health, but as we know, it does. But exactly, how do we get the investment coming? Because we see these companies actually getting funded through social capital, not through traditional capital. But social engagement solves a lot of problems because you create this pathway for engagement between caregivers and the care recipient. Once you've got this social engagement play, there's a lot that you can deliver on that platform.
Julio? Yeah, I mean, I just wanted to make a comment around that, and I think because of technology now, you can do so much more around social investment that takes the mystery and the fluffiness around it to real metrics around are people moving outside their home to do the things that they normally do to carry their normal lives, and understanding depression, understanding some of the psychiatric issues through what technology now allows you to do. So I think that is changing. I mean, there are some solutions now in the market that help people understand and make relations to psychiatric issues and through the kind of the social aspects, whether you're texting, whether you're getting out of your home, whether you're moving around your home. So I think there's a lot that now we can do that is quite incredible, and moving the conversation around social engagement to metrics that actually can help us do something about it. So
yeah, but what does Pfizer care? You just want to push more pills, don't you?
Yeah, we don't care at all. Well, so for us,
I was teeing him up. He's got an answer.
Yeah, right. For us, customer insights are critical, right? So if we were one of the first pharmaceutical companies, and maybe companies in general in the healthcare space, to look at engagement of people and their disease, not just from the moment that they're taking a medication, but actually from how does this disease start, when and why are they going to the doctor, what are the conversations that they're having with the doctor, what is the kind of access that they have, and then what is happening after they actually get that drug approved and take it from the pharmacy in terms of outcomes. So when we look at diseases, we look at the whole spectrum of that engagement of the patient through the eyes of the different stakeholders as well, the payer, the physician, the caregiver. And I think for us, that has been part of the way that we work for many, many years now. I think what's changing is that it's not only about how the patient is carrying through their journey, but it's now also about all these different solutions that are really changing the dynamics of how you engage with your disease from the moment that you discover that disease to the moment that you get prescribed the drug. So for us, that journey, that whole journey continues to be critical, but now it's really important to engage with entrepreneurs that can help us understand with these new solutions, how is that behavior changing and how is that impacting presentation to a physician, decisions around treatments or outcomes around a particular drug. So we can't do it alone, and that's partly why Catalyst is so important. But I think the entrepreneurs have a critical role to play because they're the ones that are coming up with these solutions that are really changing the way that we engage with healthcare.
The new pharma.
Well, the new old pharma. It's the pharma, plus, I would say.
Okay.
Pharma 2.0.
Yeah, I think for United, getting closer to the consumer has been something that we've been really working toward over the last couple of years. And there's a number of different things that we've done to really help bring them closer to informing the innovations that we're testing. And it depends on what project it is, but really just a few examples are things like, we formed a human-centered design studio and brought in many human-centered specialists and anthropologists who can really help bring that discipline to our product development. We've also formed an innovation garage that is really rooted in the principles of the lean startup and are using a lot of that methodology to really make sure that we're hearing the voice of the consumer from the very beginning, rather than just bringing it to the consumers after that it's been developed. And we've come up with some pretty innovative ways of doing that. I think we've shifted away from some of the traditional research methods such as focus groups. I mean, we're doing a lot less focus groups and a lot more out into the field interviewing customers, working with them one-on-one to really understand the problem, because a lot of times that's really, I think, where the sweet spot lies is really helping to get to the very root of the problem that needs to be solved to make sure the solutions that we're developing will meet that need.
So what are the motivations for someone like United to keep iterating and evolving and innovating? I mean, there's changes in the model of insurance coming, of course, and then those sorts of things. But why are you guys doing all this?
Well, I think we have probably a litany of failures that we can point to that we've learned a lot from. And I think that really not only disappoints us, but also excites us quite a bit, because those learnings can really be applied to many different ways of raising the next version of that. And there's many examples of products and services that we have that we're improving on, and it continues to get better and better because of those failures. So I think there's a lot of opportunity in many of the spaces that you talked about with Catalyst, and that's why we're very excited about being involved in this
So
work.
I have a question for you. I mean, United does a lot of great research internally, whether it's product innovation, consumer insights. You've got a health transformation trial that's been going on a multi-year. Mm-hmm. How do you unlock some of the value that you're sitting inside the organization? You've got lots of big data. You've got big data sets. What does it take for a large payer like yourself?
You said big data. Lisa's going to make you do a shot.
Oh, shot. That's always an easy one. How do you get an organization like yourself, traditionally, rooted in self-preservation, to unlock some of this data and actually help the marketplace? And this is one that everybody struggles with. But how do you say, if I can let go some of my failures and let the market know that we've tested X medication adherence and all of them terrible, I'm just going to be polite.
You're keeping it clean.
Right.
Why? So that's the thing is, how do you get even yourself, right? Mm-hmm. The learnings that you guys said are amazing, but it never gets out of the door. How do you change that?
That's a good point. I think we're starting to have those conversations. We are by nature a very productive organization, but with our capabilities that are being developed at Optum Labs, for example, I think there's going to be much more of a demand to access that data set from many different places. So there are conversations about how do you democratize that data in a way that will make it useful for entrepreneurs while still protecting that asset.
Great.
So something I always am fascinated about Georgetown Hospital, because they're in your backyard, but I didn't realize that unlike other health systems, they've got a two-sided equation. One is to help the mothership in innovation, but you also actually have a commercial interest in helping entrepreneurs. So can you just talk a little bit about that?
Yeah, at MedStar Institute of Innovation, we are a innovation platform for entrepreneurs, anyone, even from outside our system, that wants to forward and bring a medical device or a new medical innovation to market. And we're a common platform with the Cleveland Clinic on that, and we work together. We call it napkin to market, from a sketch on a cocktail napkin all the way to market, whether it is getting capital or whether it's prototyping or design research, any of those components going forward, we assist with that, and we have a number of things in the pipeline right now. We're relatively new at it. We're certainly not have as many patents pending as Cleveland Clinic does, but we work with a common platform with them and are very excited about the prospects going forward.
And what's the, I'm all about motivations today, but like, so what's the motivation behind that? Is so you guys will eventually benefit from better products that you can then use within the system,
Okay, so
or is it a positioning thing? Or?
Yeah, there's multiple benefits. One, we can benefit from these products themselves. We invest in these products and have a commercial interest in them, and there are royalties involved in that. It is a number of systems believe that they cannot survive into the future without having some kind of other kinds of revenue flows other than direct patient care, that they'll have to have some kind of ancillary flows. So that's positioning for way out in the future. Okay,
Julio, you get the last word. We have 12 seconds left.
12 seconds. Yeah, I mean,
or over. We're counting up now. Oh God.
Oh, wow. We're making time here.
It's all about pharma, man.
Yeah, it's incredible.
There it is.
It's incredible. We've bending the laws of relativity. I mean, I just wanted to say that, I mean, entrepreneurship is also critical for us. I think I mentioned it earlier. It's something that a space that we think is where a lot of the solutions are going to come from, and that we look to continue to engage meaningfully in that space in ways that mutually benefits Pfizer and some of the entrepreneurs are relevant to the things that we're interested in.
Great. I see Jill. I'd like if you...
You do? Are you sure?
I don't hear you. So if everyone could take a round of applause to thank our panelists for coming out, and appreciate your time and attention.
And we'll be really, really looking forward to seeing the results of Project Catalyst. I'm really interested in that.
Oh yeah, the first study we're releasing the first week in July, right?
Yes.
And then look for more results in Q3 and Q4 on the other studies.
That's awesome. Can't wait. Thank you.
Thank you, guys.